Mesdames et messieurs, bonjour et bienvenue sur Africa 24. Dans ce nouveau numéro de décryptage, nous allons à la rencontre du docteur Christopher KAYUMBA, de nationalité rwandaise. Il est professeur d'université et également journaliste émérite. Avec lui, il sera question de parcourir le contenu de sa lettre ouverte adressée au président de la République Paul KAGAME. Lettre dans laquelle il évoque la gestion de la Covid-19 par son pays, le Rwanda. Une gestion jugée exemplaire aux yeux de plusieurs organisations internationales, mais qui comporte également des failles, comme le décrit le chercheur rwandais. Pourquoi une lettre ouverte au président de la République?
The reason I wrote to the president are threefold. I can put them in three categories. Reason number one, the reason I wrote to the president was to highlight the consequences of COVID-19 and the strategy that was taken. Because although I could see every day the consequences of COVID-19, the consequences on poverty, the consequences on our economy, the consequences on relations between the citizen and government, and I was not seeing these things in the media. So some questions, the effects of COVID-19 was not being explained in the media. So I thought, let me highlight the social, economic, and political consequence. Secondly, the reason I wrote, I also thought that the strategy used is not serving the original purpose for which it was started. So I thought it is better to rethink the strategy. At the beginning, when COVID came, nobody really knew how to handle it. So they put in place a strategy. So I was thinking that it is best if that strategy is addressed and rethought. And finally, I also wanted to propose what can be done to ensure that first, COVID-19 is defeated, and secondly, the country is put back to its development trajectory. Because if you have been following, you will notice that the government's development plan, which is based on meetings, conferences, incentives, and things like that, has been badly affected.
Le Rwanda est félicité pour sa gestion de la crise de Covid-19 au niveau international. Comment comprendre donc le bien fondé de vos critiques contenues dans cette lettre?
You can understand why. Because as you remember, COVID arrived here in March last year. And immediately, government took steps to control it. And the president promised that he would follow science, that he would follow the advice of medical doctors and make sure that guidelines given are followed. So if you look at it from a healthy standpoint, from a medical standpoint, they have managed to control the rate of deaths. People have died a few. They have managed at least to slow down infection rates. But there is also another angle. Because I think if we are to judge the strategy used, we must start from where we are in March last year. What was the intention? The intention was to make sure that COVID-19 is defeated and life is back to normal. Have we achieved that? I don't think that that has been achieved, because as you know now, the country is still under partial lockdown. And I think the reason why we have not defeated this disease are threefold. Number one, I think COVID-19 has 4 eyes, and therefore 4 related solutions. Eye number one is a healthy eye, which I believe that is the angle government took. If you look even at the strategy used, the government puts in practice the advice from the Ministry of Health. But this disease is more than a health problem, which brings me to eye number 2. This disease, coronavirus, is also an economic problem, which means if it is an economic problem, it has an economic eye. I would imagine that the best strategy would have been to combine advice from the Ministry of Finance, factoring in the economic consequences of the virus. But that is not all. COVID-19 also has a third eye, the eye of business. Because businesses, if you look at the different studies conducted, people are telling you the informal sector is almost non-existent. Small businesses are almost dead. Production is very low. Demand is very low. Supply is very low. So what do businessmen and women think? I think that should have been factored in. And finally, which is the fourth eye, which to me is extremely critical, is COVID-19 has the eye of, because it is also a food problem. How about an ordinary person, you and me? Ask yourself, we are into the 11th month. Why are people not wearing masks? So it has a perceptual problem which relates to the food issue, which relates to the way people live, basic needs. So therefore, if we had used all those four eyes, the strategy to manage it would have been different, and I believe that we would have been able to contain both the infection rates, death rates, but also manage the food issue, make sure that businesses are not completely out of production, make sure that the economy is not very low.
Quelle appréciation faites-vous de la gestion par les autres pays de cette double crise sanitaire et économique?
Yeah, that is a very good question. I think if you look globally, I would broadly say that COVID-19 was poorly managed by almost all countries. I'm saying almost. Why? Again, because of the way we human beings and government are used to solving problems. COVID-19 was taken as a technical health issue. But it was more, and it is more than a technical health issue. Like I said, COVID is also a perception issue that deals with basic needs and food. It is also an economic issue. It is also a business issue. Therefore, there are some countries that have done better than others. I'll give you an example. If you look, for example, at New Zealand, New Zealand has done a very good job. If you look at South Korea, South Korea has done a very good job. If you look at Singapore, Singapore has done a good job. Look at Japan. Japan has done a good job. Look at China. China has also done a good job. And recently, I think the UK has woken up to the realities of COVID, and they are taking a very different approach to the one they used. Because at the beginning, UK also used the technical approach to COVID-19, only listening to medical doctors and technical experts from medical professionals. But now they have taken it as a political, social, and economic issue. And they have even given a timeline on which COVID will be defeated. So broadly, we would say that most countries struggled, but there are some that manage it better than others.
À vous écouter, le Rwanda devrait peut-être changer de stratégie.
Yes, I think it would benefit Rwanda a great deal if we revisited the strategy we have used. Because I think the strategy we have used has been to securitize COVID-19. It started as a health issue, and then guidelines were given, washing hands, social distancing, wearing masks, and then they gave the job of the police to make sure that everybody implements those guidelines. As you know, you journalists reported that many people were arrested, many were imprisoned, many were fined. So how do you fine people who are already impoverished, who are not working? So I think that is not the best approach.